Okay, hi Lisa, my name is Marley. I'm going to be your clinician today, and today I just want to do a cranial nerve assessment on you to make sure you have your sensation and all the motor aspects of your nerves, just to make sure everything's working. Okay, how does that sound?
Good.
Okay, and is it all right if I touch you?
Mm-hmm.
Okay, so first I'm going to wash my hands. Are you ready?
Yes.
Okay, so the first cranial nerve I'm going to assess is your olfactory nerve, so your sense of smell. So I want you to close your eyes. I'm going to place a scent under your nose, and I want you to tell me what you smell.
Vanilla.
Yes, that was my vanilla hand lotion. Okay, so the next cranial nerve I'm going to assess is your optic nerve. So this is just your vision. I'm looking at your peripheral vision and just how we can see, okay? So I want you to cover your right eye, and I want you to look right at my eye right here. And I want you to tell me what numbers I'm holding up, okay?
5, 3, 2.
Okay, so now we're gonna switch eyes and we're gonna do the same thing on the other side. I want you to keep watching my eye.
5, 4, 1.
All right, good job. So next we're gonna move on to cranial nerves 3, 4, and 6. I know it's a lot. So it's our oculomotor, trochlear, and our abducens nerve. So this is just basically how your eyes move, okay? So I want you to keep your head still, and I don't want you to move your head. I want you just to move your eyes and follow my pen light, okay? Got it?
Got it.
Okay. Okay, so the next part of these 3 cranial nerves is I'm going to go dim the lights, and I want to see how your pupils constrict to the light, okay? Okay, so I'm going to go dim the lights. And I also want you to stare off to a distant object, just to help your eyes kind of accommodate and everything. Okay, so if you want to look at me. Okay. Okay, I was just looking at the constriction there and making sure everything was good. Okay, so I'm going to turn the lights back on, and I'm going to let your eyes accommodate to everything, and I want you just to watch my pen. Right, there we go. So we're moving on from all of our eye cranial nerves, and now we're going to look at cranial nerve 5, which is our trigeminal nerve. So, can you clench your teeth for me? Okay. Keep clenching. Okay, now I want you to open your mouth against my resistance. Okay, good job. So now, moving on, we're going to do cranial nerve 7, which is our facial nerve. So I want you to close your eyes tightly. Good job. Now I want you to smile. Good. Now frown. Now puff out your cheeks. Okay. Next, we're going to move on to the cranial nerve 8, which is our vestibular cochlear nerve. So this is basically your hearing. So I'm going to close off this ear, and I want you to tell me what you hear. I'm going to whisper some words over here, and I want you to tell me what words you hear, okay? Rose, cat.
Rose, cat.
Very good. Okay. I'm going to occlude this ear, and I want you to tell me the same thing. Dog, swim.
Dog, swim.
Okay, good job. Next, we're going to look at your glossal pharyngeal nerve, this is just our tongue and everything in there. So that's cranial nerve 9. Sorry, I'm trying not to sneeze. Okay. All right, can you stick out your tongue for me? Can you say, oops, sorry. Can you say, Okay. Now, I'm also just going to test your gag reflex, okay? Okay. so moving on, now I'm going to look at your cranial nerve 10, which is your vagus nerve. And since, we've been talking, I can hear you don't have any hoarseness in your voice. And then, can you give me a swallow? Okay, so you have a good swallow, so I'm going to move on. Next is cranial nerve 11, which is our accessory nerve. So I want you to move your head side to side. Now, move it up and down. Now I want you to shrug your shoulders against my resistance. Okay, good job. Moving on to cranial nerve number 12, which is our hypoglossal nerve. So this is also just our tongue movement. So can you stick out your tongue and move it side to side? Okay, well, good job. That was your cranial nerve exam, and you passed.
Yay!
So basically, my opinions of this article, after reading the article and doing the peer-to-peer examination, is that I agree with the graduate students' opinions in the article that it supports your confidence in evaluating the cranial nerve function, and it also helps with your greater abilities in identifying and explaining the underlying diagnoses and etiologies, and it just contributes to your overall knowledge. So I agree with all of that. I think my one note about this is that it would be better to kind of facilitate learning, to also discuss what might be wrong, what we might see. So say if you couldn't do the tasks for the facial nerve, kind of just making note of that, and then maybe doing something afterwards, like a peer discussion about why the facial nerve might be, is it compressed? Is something going on that's causing it not to function correctly? And kind of like be surprised throughout the exam if they don't do something correct. Maybe they have like a surprise diagnosis in their head that they picked out, and you do the exam and you don't know what it is. And then afterwards maybe discuss, like your olfactory nerve, like you said you couldn't smell what it was. Maybe do you have a tumor pressing on your olfactory bulb? And like try to do something like that just to help further facilitate learning. And so I think maybe that would be helpful.